Hi, I'm Dr. Shane Ashline with Oak City Chiropractic, and today I'm going to talk to you about Facet syndrome. Facet syndrome is an injury that occurs between two vertebrae in the spine, and it can be anywhere from the lumbar spine up to the cervical spine. Today we're going to talk specifically about the cervical spine. The facet joint is where a top vertebrae and a bottom vertebrae meet like so. And what ends up happening is you either get a jam or some kind of compression, which will cause inflammation in the joint space, which will create a sharp or dull ache. Most commonly, you'll feel it when you try to turn your head or bend your head, and you have a sharp pain that won't allow you to have your full range of motion. You can get this from sleeping in a compromised position. You can get it from trauma. You can get it from having poor posture. The way I like to treat it is in 3 simple steps. You're going to first elongate the joints. You're going to elongate the muscles, and then you're going to adjust the joints to improve the range of motion overall. So what you're going to feel first is some soft tissue work, which I start with the trapezius, which is a muscle that starts in the shoulder and goes up into the neck. And by doing that, I bring the person's head to the left or the side that I'm treating. I'll grab the muscle tissue and push it in the opposite direction, and then force the muscle through its full range of motion, pausing at the end. This can create a little bit of pain while I'm treating it, but what we're doing is relaxing the muscle spasm in the muscle that happens from the pain. Your body sends out a signal when there's inflammation or any kind of compromise to the joint to stop you from moving. And the way it does that is it squeezes the muscle and it reduces the range of motion you have. So what I do is I forcefully open that up within pain tolerance. So we start with the trapezius. We'll move that from side to side. I'll typically treat this for about a minute or 2, depending on how long it takes for the muscle to fully relax. Then I'll move on to the next muscle, which is typically the levator scapula. And this one goes from the shoulder blade up into the back of the neck. And it's the same concept. I'll take it through its full range of motion, pausing at the end to your pain tolerance. Once I feel that muscle relax, I'll move into the rhomboid minor, which goes from the shoulder blade to the top of the spine. And my thumb will sit here. I'll bring the patient's arm around the front like so. And I'm just fully lengthening that muscle again. Now, sometimes with facet syndrome in the neck, you'll get pain that kind of shoots down inside the shoulder blade. And that's from these muscles. You'll get pain both at the insertion and the origin site. So you want to make sure you're treating both ends. We're going to have my patient lay on their stomach. One of the first adjustments I do with this is the rib head. And the rib head is very important because that's where that rhomboid kind of comes across. If the levator and the trap are pulling that shoulder blade up, you're going to get restrictions in there. So if you don't clear this, the pain won't go away. So we'll have Dr. Jackie take a nice deep breath in. She'll breathe all the way out. I'll lean in gently and then push down like so. And you might get a pop, you might get a click, but we're just looking for some motion in that joint space. Go ahead and lay on your back. From there, we'll have the patient lay on their back. And now I'll treat the insertion points of those muscles we were talking about earlier, the levator scapula, the trapezius, and then some of the smaller spinal erector muscles. So what I'll do, same concept, I grab the muscles and I move the head side to side, forcing them to elongate and open up. This also opens up the joint space, like I said earlier. Working through patient tolerance. Then we move over into the small stabilizing muscles of the neck, such as the rotatories longus and brevis and the multifidus. We force those to open up. Again, all along, just trying to make sure the patient is comfortable. And then from there, we'll do a spinal adjustment. So I'll tell Dr. Jackie to just relax, try and let me move her head for her. I'll bring her head towards the affected side at the specific spinal level where she's feeling the pain. We'll have her relax. And just let that go as best you can. And then we deliver a low velocity or high velocity, low amplitude force through the spine. What I'm trying to do there is shove the joint over a little bit to create space. I'm not grinding the joint on it. I'm actually kind of opening it up. And that allows the fluid inside that joint space to refill that gap, gives you a little bit of cushion and gives the joint its full range of motion. That's basically facet syndrome in a nutshell.